Hello, I'm Stephen Thomas and I'm a podiatrist, which is a foot and ankle specialist, and I'm based in Harley Street in London. In this video, I'm going to go through the common treatments for Calcaneal Apophysitis, also known as Sever's disease, which is a common heel pain condition in children between the ages of 8 and 15. If you have not seen my previous video on the condition and the risk factors for developing it, please watch that one first. Typical treatments for Calcaneal Apophysitis can be broken down into two main categories. One is medical and two mechanical. The medical treatments focus on using anti-inflammatory medication such as ibuprofen, which can be taken orally by tablet or using a gel to be applied topically to the heel. Mechanical treatments involve the use of heel raises, calf stretches, orthoses, and activity modification. Anti-inflammatory medication, such as NSAIDs, these work by reducing inflammation in the area, which of course then reduce the symptoms. They don't necessarily target the underlying cause, but they can provide a huge amount of relief. In a recent study published in 2020, ibuprofen alone settled 93% of cases within 2 weeks. However, I usually recommend to my patients not to take ibuprofen for longer than 1 week, as it can upset people's stomach. Ibuprofen and diclofenac gels can also be applied to the heels topically, but the packs say that they shouldn't be used in people under the age of 14. Anti-inflammatory medication aren't for everybody. Some people are allergic and other people just don't want to take medication if they can help it. And of course they tend to target the symptoms as opposed to addressing the underlying cause. So this is where the mechanical treatments come into play. Mechanical treatments aim to reduce the forces going through the heel, which are the likely cause of the condition. So a heel raise is something simple that can be put inside the shoe or under the factory insole within the shoe. And the way it works principally is it lifts the heel up and effectively shortens the length between the heel and the knee area, which of course then slackens off the calf and the Achilles tendon. Just by slackening that off will reduce the tension pulling at the back of the heel. Heel raises are generally a temporary measure just to get through the rehabilitation period. Used over a long period of time can cause the calf to adapt and then slightly tighten itself. That's why we usually integrate some calf stretching exercises as well. Orthoses can be used and they come in two main types. There's an off-the-shelf or a custom pair. This particular pair is a custom pair that I made for myself. So these go inside a trainer or a sports shoe. You can get smaller ones, slimmer ones that can go into a slimmer shoe as well. But the way these work is they stabilize the foot, they reduce high impact areas of the foot, and of course with the custom you have a lot more choice of fine tuning that you can build into it, such as extra shock absorbency into the heel, and of course already discussed a heel raise built into the device as well. A recent study in 2021 showed that both heel raises and orthoses improved symptoms. However, the group that used custom orthoses had a greater improvement. Calf stretches aim to lengthen the calf muscle and the Achilles tendon, and so doing so you reduce the forces that are pulling on the back of the heel. You may need to be careful with stretches, as any aggressive or ballistic type of stretches may worsen or prolong the symptoms. So these are usually advised to be very gentle and slow type of stretches. Activity modification usually involves reducing or stopping any high impact activities such as running and jumping. The reason it's these activities is because these ones are usually the ones that put most forces through the heels. So if you continue to do these types of exercises, you may exacerbate or prolong or even make the symptoms even worse. As mentioned in my previous video, people who are overweight may be slightly increased chance of developing this condition. So of course, if you are overweight, just reducing some weight will reduce the overall load going through the heels. And to conclude, of course, every patient is different and nobody is the average participant in a clinical study, so treatments will need to be tailored to the individual. This may include one, some, or all of the treatments I've mentioned today in varying degrees. I hope you found that video useful. Please give it a thumbs up if you liked the video, because it really helps me. Subscribe to the channel if you want to stay up to date, and share with any of your friends who you think may find this useful. And thank you for watching.